So my name is Pankaj Sharma. I'm Professor of Neurology at the University of London, and I'm Director of the Institute of Cardiovascular Research at Royal Holloway College in the university as well. And my major interest within neurology is stroke. And although stroke occurs mostly in the elderly population, most people think actually it's a disease of the elderly. About 25% of all stroke occurs under the age of 65. So although most people think it's an old age disease, but actually it's very common. 1 in 4 people are under the age of 65 when they get a stroke. And the reason I got involved in Different Strokes is because it's a charity that specifically targets people who have had a stroke younger in their life, and they have different demands and different needs. They often have young families, they often are in employment, and that's going to cause a problem for them. And also the research side of things, the reason why young people have a stroke is slightly different from why the elderly population have a stroke. And that's what interested me, and that's why I got involved in Different Strokes. The good news is that stroke actually in the UK is falling, which is great news. The numbers are actually going down. And the reason the numbers are probably going down is because we're better at treating high blood pressure. There's no question that high blood pressure is the commonest modifiable cause for stroke. And as the numbers of people who are affected with high blood pressure goes down, as doctors and clinicians and nurses are getting better at treating high blood pressure, the incidence of stroke is going down as well. But remember that stroke occurs every 4 minutes in the UK, so it's still a very big disorder in terms of the burden on the NHS and of course the burden to patients and their carers as well. So although the numbers are going down, they're still quite large at the moment. The commonest cause for stroke actually is age. So although over the age of 55 the risk doubles every 10 years, under the age of 55 the cause is a little bit different actually. And some of those causes can be related to trauma in the neck. If you have a neck injury, the blood vessels that supply the brain from the neck can get damaged, and that's caused a dissection, which means that a ripped artery can cause a clot to fly off into the brain. Other causes for stroke in younger populations can be people that are born with a hole in the heart. Everybody is born with a hole in the heart when they're born, but about 25% of people, that hole doesn't close as they take their first breath. And that allows a shortcut for a clot to go through the lungs, bypass the hole, and then go straight into the brain. And so that's quite a common cause for stroke in young people. Obviously, there are genetic causes as well. Stroke often runs in families in young people, and there are very specific genes that can cause that kind of stroke. But other causes are very similar to those in the elderly population. Smoking, alcohol, substance abuse, cocaine, a lot of people doing that in the younger age group, and that can cause a stroke as well. There are 2 main types of stroke. There's an ischemic stroke, which is a clot, and there's a hemorrhagic stroke, which is basically a bleed in the brain. But actually the presentation of the symptoms that a person comes into hospital with or tells their doctor or nurse that they're likely to be having a stroke are very similar. And the symptoms are that they can lose the power of their face, one side of their body, their arm or their leg, all 3 sometimes, but not necessarily. It can be just isolated to an arm or a leg. That's actually a very common symptom, and it doesn't matter whether they're having a clot or a bleed that's causing the stroke, that actually presents very readily. Other causes and symptoms that can occur from either a clot or a bleed, they can have loss of vision in one eye or both eyes, or they can lose their ability to speak as well. And that's what led to the very successful campaign the government's currently running called the FAST campaign, where if one side of your face goes floppy, that's the F. If you can't keep your arm upright and it's becoming weak, that's the A. If you're unable to speak properly, your speech is slurred in any way, that's the S. And then it's time T to call 999. That's been a very successful campaign, and it summarizes the symptoms of stroke extremely well. The short-term effects of stroke are really confined to what parts of the body have been affected by the stroke in the brain. And if their arm has been affected, then they'll become weak. They may not be able to write, particularly if it's the dominant hand that's been affected. If their legs have been affected, they may not be able to walk, and they might need a wheelchair in the early stages, certainly. Speech is often a problem, in which case they'll need speech therapy. But those are the acute stages, the early stages. And what happens is that as the brain rewires itself, and its ability to actually rewire itself is improved, the younger the person is. So young people actually improve better than older people because their brain is said to be plastic. It can mobilize itself and then bypass the damage that's been done. But it's a long process. All of these symptoms can stay with a person for a very long time, and it's only with regular physiotherapy, regular speech therapy, that these symptoms can actually resolve. And they resolve fastest within the first 6 months, and then they continue to resolve probably for about another 18 months to 2 years. So it can take over 2 years to get to a stage where you're stable. And in between those 2 years, you're improving all the time. Anybody that's had a stroke or a TIA is at risk of having another stroke. And those risks vary depending on the kind of literature that you want to read in terms of research that's been published. But on average, it's about 5% per year, every year for probably the next 5 years, something like that. If you've had a mini stroke, a TIA, the risks are very high in the first week or two. So that's why it's very important to get to a doctor very quickly so that we can treat the risk factors very readily and reduce your chance of having a stroke. If you have a mini stroke, a TIA, you've got an 80% chance of having a full-blown stroke. So it's very important to get that sorted out. But the long-term prognosis really depends on the kind of stroke that you've had. If it's affected you quite severely in terms of physical ability, then obviously that's going to play out in the long term. And we need to put in strategies that can help you live your life. So if you need crutches, if you need support at home, someone to do the shopping for you, all of that needs to be put into place. So although the prognosis actually is pretty good following a stroke, especially if you're young, because the brain is plastic and it can rewire itself, people are often left with the long-term problems of stroke, which can be related to relationships, their carers. It often affects them quite profoundly. And the person that's had a stroke, they can get depressed as well. Depression is a very common finding in stroke, certainly on the long-term basis. And about a third of all patients with stroke will have depression. But the point that I want to get across actually is that there are lots of structures in place to help people recover. So the long-term prognosis actually is very good. We can help you get over the depression side of things. People often have very good family support, particularly when they're young. They've got a good incentive to recover themselves. We can get physiotherapy in, we can get occupational therapy, speech therapy in, and employers actually are usually very willing to be assisting in your recovery as well. So all of these things can come together to help you improve your long-term prognosis. The commonest cause for stroke, without a doubt, is blood pressure, and that's the one thing that we can do something about. So if I was to give a tip to people watching this program, I would say that get your blood pressure measured and get it down. There's no such thing as low blood pressure. My definition of low blood pressure is when someone stands up and gets dizzy. That's the definition of low blood pressure. The lower your blood pressure, the lower the chance of having a stroke. And in terms of other things that one can do to prevent your risk of having a stroke, none of them will come as a surprise. It's good exercise, keep your weight down, don't smoke, don't take illicit drugs, reduce the amount of alcohol that you're taking, and eat well. 5 fruits and vegetables a day at the bare minimum. All of those will do an enormous amount to keep your risk of stroke down. So once someone's had a stroke, the care that they receive in hospital is actually pretty good. The road that someone walks down in an acute setting in a hospital is very well established now with the advent of stroke units, and they're widespread everywhere. The problem, however, is when we discharge them from a hospital. The community care can be lacking at times, and to be perfectly frank, there is often a postcode lottery that some areas do provide very good physiotherapy and occupational therapy and speech therapy very regularly, and in other areas it may be wanting in terms of the type of frequency that people do need. If you do find that the kind of physiotherapy and the frequency in terms of speech therapy or OT that you require is not being given, then I think the first port of call is to go to your GP and try and see if there are other services that can be accessed more frequently, or what kind of pressure that your GP can apply to the local health service in the community to get those physiotherapy and other needs that you require. The GP undoubtedly is the first port of call for these kind of issues, and they will have information and access potentially to the people who can make things happen. But it is difficult because we do know that there is this postcode lottery, and at the current time where the NHS is under severe financial strain, it's not that surprising. But that actually shouldn't be an excuse to not receive the therapy that you require to make the fullest recovery that is possible. So you should keep pressurizing your GP and your local health service. And if that doesn't work, then quite frankly, I think you should pressurize your local Member of Parliament as well. There is really no excuse for not getting the kind of care that you require just because of the address and the street where you live.